Infectious disease specialist Dr. Zain Chagla joins us. Good morning. Good to see you.
Hi, good morning, Bob.
Yeah, sorry I missed you last week. I was doing the self-isolating thing. Without a test kit, my wife remained a presumptive case. Let's talk about test kits. First of all, how to test if we do get a rapid antigen test, because we're hearing like it's better to do a different, like a throat swab first.
Yeah, I mean, so there are some studies suggesting the throat and nose may be a bit better than just doing the nose alone. There's a couple of reasons. One is, presumably, if you've done your nose, some people can't do it far enough. And so, adding some more tissue to actually scrape may actually increase the benefit. The other part is, there may be some evidence that it circulates, Omicron particularly circulates in the throat before it goes to the nose, and that might increase the yield. It's still important to know what your kid is able to do. The other big thing people don't realize is they must not eat or drink before they do that swab. Is things like residual food or drinks can often make that test go positive. So, do it properly, do it without stuff in your mouth, and try to follow the directions if you can.
Yeah. Now, U.S. President Biden is mailing out test kits to every American household. Is that somewhere where Canada's falling down?
Look, I think there may be a need to improve where these tests go. Certainly there is a need for rapid diagnosis in things like schools, daycares, so that kids have access to testing, that parents know what to do with their children and whether to isolate. Elderly individuals who may not be able to access test centers probably do need to have these tests in hand. But it's a bundle of tools, right? You still have to create the supports and resources for people if they test positive to not necessarily have to go back into society, be incentivized to do that testing. And so, on its own, it may help in certain populations, but, as a general broad overview, it's a bundle as part of the tools. And we really have to incentivize people to get tested as compared to just giving them tests.
Yeah. Let's talk about restrictions. Britain and Denmark have completely dropped COVID restrictions. They're riding it out from here on in and just treating it as an endemic flu. Is that premature, and how close are we to getting to that point?
We're still fairly high in our wave. I think those countries have seen their declines. Dr. Moore did talk about this yesterday and realized that there has to be a pathway to live with this virus. Omicron has taught us, unfortunately, that all of our controls, will help mitigate the severe complications, will help mitigate the vast majority of people ending up in hospital with vaccinations and therapeutics. But, to say disease activity is going to stop in the community is going to be hard. And so, I think we do need a sustainable path forward, a way back to normal. Are we there yet? Our hospitals are still filled. We haven't gotten surgery started. But, I think in the months to come, especially as much of the population gets their boosters, unfortunately, some of them get Omicron and immunity, there will be more control in the population to make sure that we don't see these surges, and we have things like therapeutics to help with the highest risk populations.
Yeah, I'm going to ask you about therapeutics in a minute here, but speaking of Denmark, that was one of the countries the Omicron subvariant BA2 surfaced. What do we know about it?
Yeah, so this is in the same family as Omicron. It slightly screws up the test that we use to screen for Omicron, which is a bit hard because it can kind of go under the radar. But, all the data is really suggesting that this is acting much like Omicron, still very early. It seems like it may be a bit more infectious, so the ability to infect people may be different. There was a report recently from the United Kingdom as of yesterday that did suggest the vaccines, though, are acting just as effectively for the BA2 variant, the subvariant, as compared to Omicron. So the good news is we likely will not see a huge disruption based on this in that sense. But, again, time will tell. This virus keeps changing, and we just have to be cognizant that, there may be more implications of this as time comes.
Yeah, and Pfizer and Moderna are both doing trials this week on Omicron-specific vaccines. Do we need that?
It's interesting, right? Like, can you get this vaccine out in a manner that will, give immunity to the population that estimations are 50% of the population are going to get Omicron in the next 2 to 3 months, right? So, is it going to be too late when you develop this vaccine? Should you be developing a newer variant vaccine or using targets for where things are going to show up next? It's all a bit tricky. I think there is a need to update our vaccines to deal with the fact that Omicron is probably going to be the standard. And so, when we talk about future vaccines and hopefully in low-income countries, that we can use that as the baseline as compared to the old vaccine formula.
Okay, less than a minute left, and I wanted to ask you about therapeutics and Paxlovid. The Ontario government has prioritized it for high-risk groups. We have some major shortage supplies, not only in that, but with other therapeutics, don't we? What's the status report?
Yeah, I mean, there's a global supply chain, right? And so we're a part of that. We do have Paxlovid. The biggest thing people can do, though, is if they're in those high-risk groups, recognize it. There's great information online. And if they have symptoms, contact their healthcare provider, get tested, because we're not out of those yet, and we can still reach the highest-risk populations for the next couple of months while we have supply. But people need to get tested, first and foremost, and that really is what starts the chain.
We've got another shortage. Time. I always wish we had more. But we'll talk again next week. Have a great weekend. Infectious disease specialist, Dr. Zain Chagla.